Hello, this is Dr. Joe Garri from Mosa Plastic Surgery. Welcome to episode number 16 of the Surgeon's Corner podcast, a series dedicated to patient education on topics related to aesthetic plastic surgery. In this episode, we'll discuss chin surgery or genioplasty. The menton or chin is the most anterior part of the lower jaw, also known as the mandible. In our last podcast, we discussed orthodontic surgery or jaw surgery, which is used to correct malocclusions and improve the overall proportions of the face. In that episode, we made a distinction between surgeries that address the mandible as a whole and those that focus on the chin as a separate, distinct procedure. Chin surgery can be performed either alone or in combination with mandibular surgery to improve the chin's shape for aesthetic, functional, or both reasons. The term genioplasty derives from the root words genio, meaning chin, and plasty, meaning to reshape or modify. It refers to a broad range of procedures where the shape of the chin is altered, either through chin implants or surgical osteotomies or bony cuts. This podcast will focus on the osteotomy technique, while the next episode will address chin implant surgery. To contrast these two approaches, chin implants are typically used to enhance the chin's vertical or horizontal projection, while osteotomy techniques allow for greater versatility. Chin osteotomy not only adjusts projection, but can also modify the chin's position in all three planes of space and can be reductive in nature, meaning that it can be used to deproject the chin or reduce its size. Anatomically, the chin is a midline feature that delineates the lower portion of the face and helps define the jawline, which extends from the chin to a point just anterior to the earlobe along the inferior border of the mandible. A prominent square chin is often associated with a chiseled masculine appearance, while a well-proportioned, defined chin enhances the aesthetics of the female face. Patients who seek chin surgery typically present with concerns such as asymmetry or under or over projected chins. Less commonly, patients present with concerns regarding the vertical dimensions of the chin as well. A clinical and radiographic evaluations is performed to determine the underlying issue and recommend appropriate treatment. A critical part of the evaluation is ensuring that the patient's bite is normal, otherwise known as a class 1 occlusion, which indicates that the mandible itself is properly positioned and not a contributing factor to the issues with the chin. Although there are clinical and radiographic guidelines available, determining the ideal chin position is often subjective and varies by individual. It is essential for the surgeon to counsel patients as to what to expect regarding facial proportions and aesthetics after surgery. One useful tool in this regard is preoperative visualization, where the patient can see a model of their face with the planned chin adjustments. This can be done with surgical tracings, or more accurately, using virtual surgical modeling to superimpose those planned changes on the patient's own photographs. Once the surgeon and the patient agree on the desired outcome, the surgeon can choose between two broad treatment options. Number 1, chin implants versus number 2, osteotomy techniques, depending on the patient's needs. As previously mentioned, implants are used to enhance chin projection, while chin osteotomy is more versatile, allowing for adjustments in size and position. This podcast will focus on the sliding genioplasty, a type of chin osteotomy. Chin osteotomy is typically performed under general anesthesia in an ambulatory surgical setting. The procedure begins with an incision inside the mouth in the mucosa of the vocal vestibule. This is the fold between the front teeth and the lower lip. Through this incision, the chin's anterior aspect is exposed and markings are made for proper orientation and to guide the osteotomy or bony cuts. A high-speed electric saw with water irrigation is used to make precise cuts in the bone, separating the chin from the rest of the mandible. A cuff of soft tissue is left attached to the posterior aspect of the chin bone to preserve its blood supply. Once the bone is free, the chin can then be repositioned in all three dimensions according to the preoperative treatment plan. The chin is then secured in its new position to the mandible with metal plates and screws. The anterior chin muscle is repositioned and sutured into place, and the mucosal incision is closed, usually with resolvable sutures. The procedure itself usually takes typically 1 to 2 hours to complete, and patients can return home a few hours after recovery. The postoperative recovery period usually involves mild to moderate swelling and minimal discomfort, which can last for several days. Normal activities can be usually resumed after a few days, although contact sports should be avoided for about 6 weeks to allow proper healing of the bone. As with any surgery, there are risks including bleeding and infection. Specific complications related to this particular procedure of genioplasty include, number 1, damage to the anterior mandibular teeth. This is rare but can occur during surgery because the bony cuts made are usually closed in approximation to the roots of said teeth. Number 2, numbness of the chin. The sensory mental nerve, which provides sensation to the chin, can be affected by the surgery. Numbness may be temporary or in very rare cases can be permanent. Number 3, nerve stretching. The mental nerve may be stretched during the procedure, leading to temporary numbness, which usually resolves in a few days. Postoperative care, including optimal oral hygiene, is critical to reduce the risk of infection, as the incision for this procedure is made inside the mouth. It is important to note that final results of the procedure will become apparent several weeks postoperatively, as enough time must be allowed to pass for the complete resolution of the associated swelling. It is not uncommon for patients undergoing chin projection enhancement to feel like their chins are too big initially after the surgery, before the surgical swelling has had a chance to dissipate. Patience is usually the cure for these concerns that some might feel initially, only to disappear after several weeks when the surgical swelling resolves. In conclusion, for patients concerned about the appearance of their chin, whether due to asymmetry or under or over projection, genioplasty is an effective and minimally invasive option. It is a quick procedure with a manageable recovery period and can result in permanent, aesthetically pleasing changes to the face and the chin. Thank you very much for your time. This is Dr. Joe Garri, and I'll see you in the next episode of the Surgeon's Corner podcast.